Hello, this is Dr. Saldivar. Today we'll be looking at Chapter 13 of the Feldman text, Essentials of Understanding Psychology. Chapter 13 is on the topic of treatment of psychological disorders. Now, the primary goal of psychological treatment is to facilitate lasting positive change tailored to each individual's unique needs and goals. That's kind of a mouthful, but just to unpack it briefly. Basically, as you would expect, if someone has such severe distress in terms of psychological or behavioral disorder, or emotional disorder, that they need help from a professional, the goal is first to facilitate this lasting positive change. In other words, help someone overcome this challenge, not just for today or tomorrow, but over time, as long as possible. And also tailor that positive change to each individual's unique needs and goals. So that refers to the fact that there may be one goal, one definition or description of where a patient or a client wants to get to in terms of addressing their issues that makes sense for that person, and a different definition, different description for another person that makes sense for them. There is not one one-size-fits-all approach in mental health, in psychological treatment. It really is very dependent on the needs, the desires, the goals of a particular person, and psychologists need to be mindful about this. So having described that, how do we get to this place of having this lasting positive change and being mindful that it's tailored to the individual? The first aspect of treatment is always going to be to reduce symptoms. Whatever the particular challenges or issues that someone has that usually brought them in have become acute enough that they are typically having a huge impact on someone's day-to-day life. Feelings of anxiety, feelings of depression, disputes with a loved one, whatever other issue may bring someone in. The psychologist is going to try their best to help the person reduce the severity of those symptoms so they can get back closer to normal functioning. Part of this, too, involves in helping individuals improve or even sometimes develop in the first place their coping strategies. If you have a problem with anxiety, what stuff triggers that anxiety? What is it that makes you feel anxious? Are there ways to help you think through those feelings to try and prevent the anxiety? Are there ways that when you do feel anxious that there are things you can do in terms of your own behaviors, your own thinking to try and minimize or reduce the amount of time you feel anxious? Again, there's not one right answer to these questions, but these are the kinds of questions that psychologists would look at. And then finally, establishing what are called patient-defined outcomes. Again, making sure that the individual gets to determine what state they want to reach, what is it that I want to be able to do after going through psychological treatment, as opposed to having the psychologist tell them where they should be, where they should go, how they should feel. And then finally, of course, enhancing quality of life. Some psychological disorders don't have a cure in the sense of this issue, this challenge will never bother you again as long as you live. Unfortunately, sometimes that's just unrealistic to have the expectation that you'll never have recurrence of, let's say, depression. But it is possible, again, to, with treatment and with a lot of effort, you are able, as someone, again, for example, suffering from depression, there are ways to minimize its impact. Not completely eliminate it, but minimize its impact over time so your quality of life gets closer to what it was before you started to grapple with that issue or that challenge. Now, there are four main approaches to psychological treatment. The first is that we'll talk about here is called psychodynamic. This approach is rooted in Freudian theory. Sigmund Freud was essentially, there's some debate here I won't get into for this discussion, but often seen as the founder of clinical therapeutic psychology. This psychodynamic approach starts with a strong focus on uncovering what are called unconscious motivations, stuff from our lives that's happened to us, typically early in our lives as children, that influence our current behavior. If we had a childhood where we had a lot of negative experiences, were abused perhaps as adults, sometimes the fear, the anguish, the trauma from that abuse can affect us our whole lives. And we may not even be consciously aware of how that's affecting us. Psychodynamics typically are also marked by a strong alliance, partnership between the therapist and the client. The idea here is that the therapist is not kind of giving orders or telling the client, the patient, what to do, but trying to become a partner with them, help understand their situation, how did it develop, how did they end up in this place, and then how can I, as your therapist, as your psychodynamic therapist, become an ally for you in overcoming these challenges. The end goal, whatever it may particularly look like in a specific sense for a particular patient or client, the overall place, the final place that psychodynamic therapists want to get to is helping clients develop psychological tools to deal with complicated feelings and situations so that they're able to cope with challenges in a day-to-day fashion on their own, not on their own in the sense of never having to see a therapist again, but on their own in the sense of being able to handle enough and moderate and manage these challenges, whatever they may be, on a day-to-day basis so they can live their life. And certainly you may still have, over long periods of time, maybe your whole lifetime, interactions with a therapist. But the point is to be able to get to a functional quality of life where at least day in and day out, you're able to manage things on your own. The next common approach is called the cognitive approach, also sometimes called cognitive behavioral therapy, CBT. This approach is based on the idea that dysfunctional thought, abnormal thoughts and thought patterns are really what are causing our behaviors and emotions that are problematic. The cognitive therapeutic approach is very, as some call it, now-oriented, focused on what's happening now, not so much on digging into the past the way a psychodynamic approach would typically do. So CBT therapists are focused on solving problems in the sense of what's happening with you now, how can we improve your quality of life now by doing certain things, using certain techniques, including teaching individual skills to modify unhelpful thinking in real time as it happens. So instead of having problems, having issues that are grounded or rooted in your own thoughts, your own behaviors, the idea with cognitive therapy or CBT is to get you to recognize when you're entering one of these problematic thought patterns so you can try and clamp it down in that moment instead of having to try and go through a cycle of anguish or depression or anxiety or whatever it is and then sort of have to clean up after the fact. This CBT approach has been found by research to be effective in treating conditions like anxiety, depression, other disorders that can be very crippling in how they affect people. So CBT does have a pretty strong track record, probably one of the more common approaches that you find in the world of therapy, clinical psychology, and related areas. Third approach to psychological treatment is behavioral. These focus on your current behaviors and problems and aim really at modifying maladaptive, that is troubling, unhelpful, unproductive behaviors and reinforcing positive behaviors. This is rooted in classical and operant conditioning, which we've talked about in this class previously. Key aspects of this approach, the assumption, the starting point that behaviors learn from the environment, and these behaviors that may end up causing you problems because you learn them from the environment. That means they can be unlearned or changed or modified if you make an effort to do so. Problems, behavioral therapists will usually argue, are caused by these ineffective learned behaviors. Your thoughts, your feelings have a role, but really it's the way that these thoughts and feelings are manifesting as behaviors that really need to be addressed, again, in this school of thought. The goal is to reinforce effective behaviors, behaviors that allow you to be productive, allow you to have a good quality of life, while trying to diminish or even eliminate problematic behaviors. Final approach that we'll talk here, and there are other examples beyond these four in the reading, but I want to highlight these four: family and couple therapy. This approach is focusing on improving relationships, addressing issues you may have within family groups, within couples, whether it's a romantic couple, friendship, family. So key aspects of this approach: family and couple therapists, often their starting point for trying to figure out where your issues came from or how to conceptualize them. They view problems in the context of the very often difficult and challenging relationships and dynamics that we have in romantic couples, couples that are dating, couples that are married, and other family dynamics. And all of us probably can have had experiences, not necessarily experiences that cause us psychological distress, but we can probably all relate to the fact that family and romantic partners can create challenges for us in terms of our happiness or our ability to function as well as we would like. Because of this, family and couple therapy will acknowledge and try and kind of leverage the fact that changing one part of the system, changing how you interact with one person or changing one area of interaction can often affect other areas in that relationship or that web of relationships if we're talking about a whole family. So this is something that makes this approach, it can make it very complicated and often does take a lot of skill to be able to use this approach effectively. But the goal, nonetheless, is to improve communication between romantic partners, between people in a couple, among family members, resolve conflicts among all of these groups, and ultimately enhance relationships. So you get to a point where your relationships are as strong and supportive and productive as possible to avoid having problems in the future. Other approaches are discussed in the textbook, so you can read about those. Let's briefly review these ideas that we've discussed. The primary goal of psychological treatment, once again, is to facilitate lasting positive change tailored to each individual's unique needs and goals. And the four main approaches to the treatment of psychological disorders, as we've reviewed here, are the psychoanalytic approach, cognitive behavioral, or sometimes just cognitive therapy, behavioral therapy, and family and couple therapy. This concludes this overview of these ideas from Chapter 13. I hope you found this helpful. I'll see you next time in class. Good luck.